Okay, so here we are then. And thank you very much for joining us. So today we're going to change tact a little bit and get into a broader area. We've been, going through very technical ways. So we've been doing a lot of very technical things, but today we just want to change tack. So welcome to this Connect conversation. This one is about accelerating health and research innovation in Africa. How can we do it better? And our partners for this are TIBA, which is based at Edinburgh University, SunBio, so my colleague, Professor Chakawia. We've also got Seda. So, Eric, would you like to say hello?
Hello.
Okay. Yeah, that's great. Yeah. So just to let you know that you can actually, if there's a connection issue, you can join this, or you can join us on the Facebook channel, but there's also the YouTube channel, which is really quite a rich resource for all sorts of things. This is what we've had. We've done radiopharmaceuticals in Africa. Last time we were talking about botanical safety. And then we have a course that's actually running at the moment, manufacture and registration of biological and biosimilar medicines. So today we are here where we want to talk about university and industry collaborations. And then in August, for the month of August, we will be looking at womenpreneurs, women doing all sorts of things, whether it's in tech, in business, or in bio. You can actually send an email if you want to be on our mailing list to Nano. And then she'll put you on our mailing list. Or this is just a course that's running at the moment. So we have people from the region, including regulators. So today we actually have two main speakers. So we have Dr. Janet Byaruhanga. So I've pre-recorded that, and then we have Zoleka Ngcete from MRC. And then after that, we will then have responses. And I'm quite excited that the responses are quite diverse from across the continent. So with that, I will now just get into the presentation by Dr. Janet. So if you just bear with me.
AU NEPAT. So thank you very much, Doc, and you can go ahead and make your presentation.
Thank you so much, Professor David, or are you Dr. David? So my name is Janet Byaruhanga. I am a Senior Program Officer for Health here at the African Union Development Agency, NEPAT, and I'm also the head of the health unit. I cover a number of projects. Currently, I am spearheading our work related with the promotion of the local manufacture of medical products in Africa. And I have another project that I'm working on that seeks to serve the last mile of health services to communities. So it's more or less primary health care, of strengthening the primary healthcare system project. And I hope this presentation, which is in addition to my other activities, will be useful and meaningful to you, the audience who will be listening. So without further ado, I think let me just take you through our work on health research and innovation. So this strategy that I'm going to present to you seeks to ensure that we keep at the center of ADE's support towards accelerated implementation of the African Union's Africa Health Strategy at the center. So this strategy runs from 2018 to 2030. The reason why it goes up to 2030 is because it aligns with the Africa Health Strategy and also with the Sustainable Development Goals. The African Union NEPAD's vision and mission, first of all, you need to understand, is to harness knowledge and to deliver the Africa that we want. That's our vision. Our mission is to foster the development of the continent through effective and integrated planning, coordination, and implementation of Agenda 2063 with our member states, regional economic communities, and the Pan-African institutions by leveraging partnerships and technical cooperation. By way of outline, this presentation will give you a bit of background on how we come to define and design a health research and innovation strategy for Africa, the situation analysis that was conducted to give us the background in terms of what kind of problems we will be solving with this strategy, and then the vision, mission, goal, and objectives of the health research and innovation strategy, the priority interventions that were identified, and the implementation approach, as well as how we will monitor member states and regional economic communities' progress towards achievement of this strategy. So I will not spend so much time on this. This is just to give you a brief background on why did African Union Development Agency undertake this. So Agenda 2063 requires that we have a people that live high standard of living, they have a quality of life, sound health and well-being, and an assured health security. Because of that, the African Union adopted a strategy first in 2007 until 2015 that responds to this to the health problems on the continent, and then it was renewed and revised in 2016, and this is the 2016 strategy that recognized the contribution of health research and innovation. And at that point, a mandate was given to the African Union Development Agency, NEPAD, to assist the AU to come up with a strategy to strengthen health research and innovation. And then in order to do that, AUDA undertook to do a situation analysis across the continent with the aim of identifying the gaps in the system and then suggesting a strategy to address those gaps. The gaps that were identified following a situation analysis conducted in 2017, 2018, this is what were the 7 gaps that were identified. Number 1 was the limited sustainable financing mechanisms for health research and innovation in Africa. Limited participation of the private sector in most of the research projects in Africa. Limited scaling up of products emerging from research and innovation by African institutions. Limited knowledge management and innovation dissemination systems to elevate the knowledge outputs of African research. Lack of adaptive and proportionate regulatory systems and intellectual property rights systems that support rather than stifle research and innovation. Limited South-South collaboration and coordination between scientists and funding agencies. And finally, the poor African representation in international research and funding fora, where health innovation research agenda setting and decisions on resource allocations are made. Based on the situation analysis, opportunities were also identified which we could tap into as a continent and as regions to strengthen and address the gaps that were just identified in the previous slide. Number one was an opportunity that is existent now of the growing global interest in strengthening Africa's health systems. Especially now with even COVID, you have seen there is continued momentum of and global interest towards supporting the strengthening of Africa's health systems. That's an opportunity. Number two, broad access to mobile technology that could drive growth of innovative e-health solutions. I think all of us know that mobile technology has really penetrated a lot of the African countries, including even in rural areas. So this is an opportunity that can be utilized can be harnessed to strengthen research and innovation. Integration of information, communication, and technologies into health products development and manufacturing. These are things that are ongoing currently, discussions around how to leapfrog new technologies, old technologies, and begin manufacturing our medical products in Africa. Challenging disease patterns, including non-communicable diseases, rare diseases, neglected tropical diseases, public health emergencies, and emerging conditions, offer an opportunity for innovation of high commercial and public health value. Number five, establishment of centers of competence and centers of excellence and regional institutions and other infrastructure investments. I think there's already tapping into this that has already happened at the AUDA, where centers of excellence have been identified across the continent to support innovation. Lastly, the demographic youth bulge. This is a middle class growing that are projected in Africa. They also present an opportunity for health solutions in Africa. So what is the vision, goal, and mission of this strategy? The vision of this strategy, the health research and innovation strategy in Africa, is for an Africa where Africa-led research and innovation drives health and well-being. The mission is to facilitate coordinated, sustainable, and responsive health research and innovation that will provide effective interventions for health in Africa. The goal is to promote and increase health research and innovation for improved health and well-being of Africa's people. Strategic objectives of this strategy as based on mainly the gaps, to address the gaps. So you will find that strategic objective number one will be related with strengthening capacity for sustained, integrated, coordinated, and collaborative research, innovation, and translation for health. Strategic objective two is to develop and implement sustainable mechanisms for investment and financing in research and innovation for health. Strategic goal, objective number three is to generate new knowledge that's aligned to health goals and targets, and to advocate for its translation into products, services, policies, and practices that improve health. Number four is to strengthen the data sharing platforms and systems to optimize health delivery. Number five is to advocate for the adoption of emerging technologies and supporting platforms that are aimed to improve health. And lastly, strategic objective 6 is to strengthen and harmonize regulatory, ethics, and intellectual property systems in order to maximize the benefits from African-led research and innovation for an Africa, promoting sustained investments and financing mechanisms in research, development, and innovation for health. Number 4 is supporting the generation of new knowledge and its translation into product, services, policies, and practices to improve health. And I think we had already mentioned all of this. Number 5 is to generate, warehouse, share, and utilize data to inform and guide decision-making in terms of health delivery. Number 6 is to support the development and adoption of emerging and existing technologies to improve health. And lastly, developing and strengthening regulatory systems, intellectual property, and ethics that leverage the benefits of health research. How do we intend to approach the implementation of this strategy? So as normally at the African Union, how implementation is approached is when we have a continental strategy at the continental level, we cascade it down to the regional economic communities and the member states where the actual implementation happens and where the impact is supposed to be felt the most. So as you will notice on this slide, we have the decision-making structure, we have the implementation structure, and then we have a structure where we provide guidance, monitor, and evaluate, and coordinate. So starting with the decision-making structure, the Assembly of Heads of State and Government, which is the topmost decision-making body of the African Union, receives its decisions as they are elaborated by the African Union Commission via the specialized technical committees of health ministers and those in charge of population and drug control. Once those ministers have looked at the decisions, they forward them then through the Permanent Representatives Commission and the Council of Coordination of Flagship Programs to the Executive Council, which is the body of foreign affairs ministers that then deliver these decisions to the Assembly. So that is the process of the African Union Commission of decision making. Once the decision has been made, then it goes to through the implementation process via the specialized institutions such as our own and other continental platforms for implementation. And then it's disseminated to the member states and the regional economic communities who work in collaboration with private sector through PPPs and also with support of our continental and Pan-African development institutions such as the ADB and other development partners. Then in order to coordinate and monitor the implementation of strategies such as these ones, the African Union Commission, the NEPAD, REX, and member states participate in collating the data and the reports and ensure that these go back through the cycle and back to the decision makers, able to collect and share best practices across national and regional continental. We will also be pushing for ownership by member states of this M&E approach and implementation approach, and we will be continually communicating with the member states and the regs and the partners on this. So that marks the end of my presentation on our strategy and how we work to promote health research and innovation in the continent. And for any further information about me, I think this slide will show you how to reach out and get further information. I thank you.
All right, thank you. Next, it's Zoleka from the MRC. So this Zoleka is in Cape Town, and she's going to talk about funding health research in Africa, lessons from South Africa. She's a senior program manager for grants, innovation, and product development at the South African Medical Research Council. So welcome, and thank you very much for your time. You'll need to unmute.
Okay, good afternoon, everybody.
Good afternoon. You can share your presentation.
The organizers for the opportunity to present in this platform. I'll give you a brief, in response to what I was asked to talk about. I think a brief overview of the Medical Research Council, as well as what we currently do in terms of supporting health research and innovation in South Africa. Okay, like I said, I'm just going to cover the background, the health priorities in the country, how we fund health research and innovation, as well as just a few examples of the impact of the funding, as well as some concluding remarks. So the South African Medical Research Council was established in 1969 through an act of parliament. And I think this is important to highlight because it shows this is not an initiative. It's a wholly owned intervention by the government of South Africa with the mandate to improve the nation's health and quality of life. So our mission as the Medical Research Council is informed by that mandate, and it's to improve the nation's health and quality of life by conducting and funding relevant and responsive health research, development, innovation and research translation in the country. We believe with the largest local funder of health research in Africa, our total revenue for 2020-21 was around 80 million US dollars, which is just over a billion rands. Just over 50% of this is directly from government grants. The key national department that is responsible for providing funding to the Medical Research Council is the National Department of Health. But as you'll see later, we also work quite closely with the Department of Science and Innovation. So in order to deliver on the mandate, the SMRC has 4 main functions. The first one is to conduct research. So we have what we call intramural research units, and platforms, which are basically in-house research interventions. And then we also fund research externally. We support extramural research units, which are based at universities across the country. We also establish collaborating research centers as well as grant programs. We also have a function to facilitate innovation, which is where we primarily looking at how we ensure that the research is translated into impact, and our key programs there are the Tech Transfer Office as well as the Global Health Innovation Accelerator. And then, of course, without research capacity, none of this will deliver any impact. So our 4th function is really around developing research capacity in the country through the delivery of grants, scholarships, as well as career awards. And now, what is it that we support? The funding priorities really, we rely on guidance primarily from the National Department of Health. It's really, we try to address the key the diseases that are the key causes of mortality and morbidity in the country. I think a lot of you in this platform will be aware that South Africa is primarily faces a quadruple burden of disease, being maternal, newborn and child health, non-communicable diseases, a burden of HIV, AIDS and TB, which mainly infectious diseases. As you've seen recently, we also focused on COVID-19 as an emerging threat in the country, as well as the scourge of violence and injury. I'm not going to spend a lot of time. It's simply just to illustrate that we operate across the whole value chain, so to speak, all the way from basic research all the way to implementation. So basic research is primarily around understanding what the burden is, developing key understanding what it is that is causing mortality and morbidity in the country to inform our further interventions downstream. And just a bit of background. So before 2012, this is what our grant and innovation programs situation looked at the MRC. These bubbles just represent the programs that we had at the time. As you can see, it was very limited, and this was identified as a big problem, particularly in the innovation space, when there was a science, engineering, and technology institution review of the MRC around the same time. And one of the key recommendations was that we needed to pay more of a focus on innovation to ensure that the research that we invested in had a better chance of impact. And one of the responses by the Medical Research Council was to establish a program now called that was called the Strategic Health Innovations Program, a partnerships program, which was meant to primarily focus on product development, innovation activities and establishment of platforms towards the development of new products, patents, and services, obviously with concomitant development of human capacity. And it was meant to operate from the discovery phase all the way to the commercialization phase. And at the time, it was recognized that we as a country, we did not have all the resources that were necessary, to develop these solutions, and partnerships were going to be key in ensuring that we can deliver something that is of value to the country, and a lot of this needed to be done in a coordinated fashion. So the Strategic Health Innovation Partnerships Program, which I'll call SHIP from now on, was the entity established to enable all of these partnerships, so that there was a central coordinating system through which partnerships will be managed, but also leverage all the expertise that were at various universities and research institutes around the country, and also look at partnerships with other funders of health research and innovation that had an interest in South Africa to co-support research and innovation in the country in a coordinated fashion. It was also recognized that there was a need for coordination of interventions and funding between government departments as well as other funding bodies in the country. I've deliberately left some of these names as they were at the time. Some of you will of course be aware that we no longer have a DST now, we have a DSI, but this slide is basically taken directly from the time that SHIP was established. And what I wanted to illustrate with this slide is that in reality, looking back, it's around 10 years now since this was started, and we've managed to establish and coordinate most of the partnerships that are highlighted in this slide. We work quite closely with the DOH, then DTI. We work quite closely with the Technology Innovation Agency. Of course, most of our funding goes to universities as well as research institutes. We've established some platforms. We've funded the establishment of platforms in various parts in various universities, and we have leveraged partnerships with other funders of health research, like the Gates Foundation, the NIH in the US, the Newton Fund from the UK. We've got partnerships with Sweden, India. We are very active in the BRICS science and innovation space. We've co-funded programs there, particularly around HIV and TB, and obviously we're also leveraging the small companies that we have in the country towards the development of new health solutions. And just to give you, I'm not going to talk at all about any of this, but just juxtapose this with the slide I showed you earlier, and just to have a look at how things have grown over the last 10 years, bearing in mind, again, of these bubbles now represent a program that is managed and funded through the MRC. Most of them are actually funded with partners that bring additional funding for health research and innovation in South Africa. The SHIP program itself, it focuses on mainly on HIV, TB, non-communicable diseases, maternal and child health, antimicrobial resistance, to a small extent malaria, as well as more recently COVID-19. And we focus on development of new treatment solutions, diagnostic solutions, prevention solutions, for example, vaccines, digital health solutions, and we have been instrumental in the establishment of a precision medicine program for South Africa. And this is just an example of the other strategic research initiatives that we are involved in as the Medical Research Council. Now going on to some examples of where our investments have demonstrated some impact. Just as an example, when COVID-19 hit in South Africa in 2020, basically within a period of about a year and a bit, we were able to mobilize around 400 million rands of funding to support COVID-19 research and innovation. And a lot of that funding came from external sources, but it was the fact that government was providing funding for that was catalytic in bringing on board other partners to support our initiatives in the country. And these are just some examples of solutions that whose development we have supported. One of them, if you look at the bottom, we supported the development of an app called EM Guidance, which basically it's a mobile medicine resource. It's a resource primarily geared towards health workers. It gives them, it has the essential medicines list for South Africa and a whole bunch of information to guide that would ordinarily be in a booklet format in a clinic, in a hospital. It actually enables health workers to access this information much easier. Similar example with the Road to Health mobile app, which pregnant moms receive, when they first visit the clinic and they identified as pregnant, they receive, they're registered on this app, and it follows them through their pregnancy and provides them some critical information as throughout their pregnancy as well as after the child is born, including tracking things like vaccination, the weight of the child as it develops. We also are involved, in the non-communicable diseases space. We are involved in the development of we were involved in the identification of biomarkers that can assist in screening people and inform them of the potential to develop diabetes, just on the basis of the presence of these biomarkers in their urine. We have developed together with University of Stellenbosch and a small company called Genomics, a breast cancer algorithm for early detection and deployment of correct treatment for breast cancer. We've also identified a blood-based biomarker signature for detecting the risk of development of TB in various people in the country. We also have developed in the maternal and child space a device together with the CSIR, a device called AmbiFlow, which basically enables health workers at a primary healthcare facility like a clinic to detect whether a pregnancy is at risk of terminating early. I'm not going to spend too much time on this, but just to illustrate that our ability to mobilize resources quickly and leverage the existing expertise in the country, we funded the development of two tests that were later registered by SAPRA for COVID-19 when there was a critical shortage of diagnostic tests around the world. Drug discovery, I'm sure you all know about the malaria preclinical malaria drug candidate that was developed with the leadership of UCT with various partners around the world. And finally, we've mobilized funding to support the transfer of technologies to support mRNA vaccine development and manufacturing in Africa. Just as a conclusion, I think I wanted to, through this presentation, I hope I have highlighted that the substantial funding for health research and innovation in South Africa. Because of this, South Africa is playing an increasingly critical leading role in the global research and innovation arena, and government investment in health research and innovation plays a critical role in catalyzing partnerships, most of which bring substantial additional investment into the country, but also enable the translation of research into tangible solutions. And lastly, COVID-19, I think it has really highlighted the need for countries to establish their own capacity to be able to develop and manufacture solutions for health, and the importance of collaboration, cooperation, and agility towards deploying a rapid response, I think has been brought to the forefront by the pandemic. That brings us to the end of my presentation. Thank you very much.
Well, thank you very much, Zoleka. Yeah, when I left the MRC, ship was just starting out like Noah's Ark. So I'm glad that it actually it actually took to the sea and seems to have achieved quite a lot in the past 10 years. Do we have any questions for Zoleka or comments? The one thing I just wanted to ask, how many startups are you in the startup space? How many startups have you supported in this program?
So it's a little bit of a complicated answer. So primarily, I mean, the MRC, like I said, it does have a tech transfer. It does have a tech transfer office, but basically since what it was called, the revitalization, was basically a restructuring of the MRC in around 2014. Most of the work the research that would lead to the establishment of startups is no longer conducted within the MRC. A lot of that is actually conducted at universities, and therefore the tech transfer offices of those universities are primarily responsible for the establishment of new companies based on the technologies that they have developed. But because we support that research, I think off the top of my head, I think we've, over the last 10 years or so, I think we've supported around 7 startups, to say those startups have been established on the back of the technologies that were developed through our funding. Does that answer your question?
Yeah. No, yeah,
but
that's fine.
We also have supported companies, for example, the 2 diagnostic tests that were for COVID-19 that were developed through our funding were developed by 2 local companies. Yeah. We weren't involved in their start, but we leveraged their expertise.
Okay, then there's a question here about support for the natural products or botanical space or indigenous knowledge systems.
Whether we do play a role. I don't see the question, sorry.
Well, it's been sent to me privately.
Oh, okay. Yeah. Okay, I just wanted to make sure. Okay. So basically what happened after the restructuring, I mean, the MRC used to have an in-house unit that conducted research in the space, but since the restructuring, that unit was transferred to the University of the Free State. But recently, I think over the last 2 years, the MRC recognized the need for it to operate, more substantially in that space together with the Department of Science and Innovation. And just last year, we funded just as pilot programs just to figure out where the MRC can really in its new form, where it can play a more meaningful role. And in the past year, we provided funding to support 2 projects in the HIV space. Yeah.
All right, thank you. Pumla, do you have a question, or anybody else?
Yeah, okay, I was just typing it. So thanks, Zoleka, great presentation, and Dr. Byaruhanga before. So my question is with regards, I'm looking at this fantastic investments coming from SMRC. My question is, are you able to track how much employment or what percentage of employment you're creating? Just looking at the graphic visual that you actually showed us with all those collaborations, universities, etc., it seems there is a lot of job opportunities that you could create, or you are creating via universities, etc. Is someone doing something like that to sort of see what's the impact on employment, whether it be in universities, in the communities? Thank you.
Okay, can I go ahead? Thanks, Pumla. That's a great question. The short answer is that it's not something that we have formally tracked, primarily because it is not, employment that results from what we do. As you say, definitely we are catalyzing employment, but because we don't have a direct impact on or direct control of that. It's not something that we have been specifically tasked to deliver on, and therefore we were not required specifically to report on that by any of our funders. Our main funders, the Department of Health or the Department of Science and Innovation. But this year, we will be working together with the M&E unit of the Department of Science and Innovation, looking at the next phase of the program to define, to define indicators, that we will be using in the past, in the future, to track our impact. But I think a couple of years ago, I think it was around 2018, 2019, we did do a quick, run through of some of the projects that we had funded from the start of the program, and it became apparent. I just don't have the figures at hand, so I don't want to misspeak, but it became quite clear, because the focus of our investment is on primarily, not all the MRC, but just the Strategic Health Innovation Partnerships Program is focused on the development of solutions, whether they be service solutions or products in the way of diagnostics and new treatments. The research teams tend to be comprised mainly of postdoctoral fellows, as well as senior technical people, because you're looking for people that have experience, that don't have the hang up of having to finish a degree in the next 2 years, or 2 to 3 years, depending on whether they were doing a master's or PhD program. But yeah, our initial look at that did show that our funding was really helping, and it was really helping in creating that type of employment. And it also helped the recipients to establish substantial research programs, which then enable them to source funding from,
like leverage. Okay.
Exactly, to leverage funding from other sources, because now they had resources, in-house expertise.
All right. Okay, thank you very much then, Zoleka, for that. I'll now give over to Eric. Eric, you will now handle the response and the case studies. So over to you.
Thank you, Professor D. I think we have heard from the AUD and NEPAD, the Health Research Strategy for Africa, and we've also heard from the MRC, and very interesting presentations indeed. So we'll go to the case studies and some responses to those, and also to answer some of the questions. I think let's start with Dr. Nditwani.